Hi, everyone. Welcome to How to Apply for NNLM Funding. My name is Margo Malachowski, and my pronouns are she, her. I'm an Education and Outreach Coordinator for the network of the National Library of Medicine in Region 7. Region 7 serves Connecticut, Maine, Massachusetts, New Hampshire, New York, Rhode Island, and Vermont. So we are hosting the webinar, but the webinar is open to everyone nationwide. My colleague, Rebecca Brown from the National Training Office is here with me today, and Rebecca will help me with any technical snafus that we might encounter, and we'll drop links in the chat. We have a handout for today. The link to the handout was included in your reminder email, and Rebecca will also drop the link to the handout in the chat. So thank you, Rebecca. Right. All right. Before we get into today's topic about funding, a word about who we are. The National Institutes of Health is the nation's leading medical research agency. The National Library of Medicine is an institute at the NIH. NLM is the world's largest biomedical library, which produces information resources such as PubMed, clinicaltrials.gov, and Medline Plus. NNLM is the network of the National Library of Medicine, and we are the outreach program of NLM. The network operates out of 7 regional medical libraries, or RMLs, and the RMLs offer training and funding opportunities to support equal access to biomedical information. On this slide is a map of the United States and showing you the locations of those 7 RMLs. So those are our acronyms: NIH, NLM, NNLM, and RML. I mentioned in my introduction that I work in Region 7. On the handout is a link for where you can find your regional medical library. Contacting your RML is especially important when you are applying for funding. I encourage you to download and save the handout, and I will be referring to the handout throughout the webinar. Sorry. Here we go. This 1-hour webinar is designed as an introduction to proposal writing for beginners. We offer this webinar to help prepare you for NNLM funding opportunities. Again, we have 7 regions across the country, and each region operates a little differently. The National Library of Medicine has agreements with 7 individual medical schools, and those schools make decisions about funding at the regional level. This includes considering if the proposal involves human subjects research and the specifics about allowable costs and reimbursement. We will show you how to check with your region so that you will be able to so that you can ask questions about your specific circumstances. So after this webinar, you should be able to apply for funding from NNLM, describe the basic sections of a proposal, identify types of documents necessary to include with a proposal, and recognize the common mistakes of proposal writers. For additional information, we recommend the NNLM Proposal Writing Toolkit. The link to this toolkit is included in your handout. This toolkit is an important source of information on applying for NNLM funding beyond what I am offering in this 1-hour webinar. So here's where you get to put something in the chat. Please put in the chat if you have applied for funding from the network of the National Library of Medicine before, or if this is your first time. And I will pause while you do that. Let me take a look. I'm getting a lot of first timers. Never before. Okay, great. This is for you. All right. You all have an NNLM user account. You needed that user account to register for this webinar. To apply for funding, your organization will need to sign up for a membership account, and this is free. You or another person at your organization will need to log in to your user account to fill out the NNLM member organization form. Please register for an organization form at least 3 weeks before the funding deadline. And the reason for this is that your membership doesn't automatically happen where you fill in the form and you're automatically in. Our staff will review what you submit for completeness. And an existing membership record is required before you can apply for funding. This is one of the common problems we see here at NNLM with newbies. So in the membership form, each organizational member must designate one contact person to receive communications from us. This includes communication about funding opportunities and your application. So anyone in your organization can have an individual user account to participate in the trainings, such as today's training. We just need one contact person for the organizational membership. Your organization will be listed publicly in our membership directory, and we ask that you keep the directory up to date by reviewing your information annually or whenever organizational changes occur. Again, the first step is to make sure that your organization has a membership. You can search for current funding opportunities at the links in today's handout. NNLM provides funding for health information outreach, technology improvement, data management and services, and professional development. Funding amounts range from $2,000 to $20,000. It all varies by region and type of award. On the Funding Opportunities webpage, you will need to filter to your own region. On this slide is a screenshot of the webpage with all checkboxes next to the regions numbered 1 through 7 checked. The website is defaulted to all boxes checked. You will need to uncheck all the boxes except for your region to perform your search. Generally, your organization must be based in the region where you are seeking funding, or you might be planning to do work in that region. Rebecca, is there anything in the chat that I should know about?
Nope.
Okay, great. Let's talk about what type of health-related project you'd like to do. The mission of the Network of the National Library of Medicine is to advance the progress of medicine and to improve the public health by providing all United States health professionals with equal access to biomedical information and to improve the public's access to information to enable them to make informed decisions. We fund organizations to help us accomplish our mission. Maybe you want to support efforts to address the social determinants of health, such as housing or food access in your community. Or you could be looking to bridge the gap between researchers and patients by designing a participation in research project. You could join a community coalition to do a health promotion, such as walkable communities. Or what we commonly see here at NNLM is programs to teach self-management of chronic conditions by offering classes in how to use Medline Plus. A lot of libraries and community organizations do health screenings, such as screenings for sexually transmitted infections, blood pressure, and diabetes. Libraries and community organizations offer peer support or social participation events such as memory cafes for people with dementia or low sensory story times for people with autism. These are broad categories of ideas. So I will pause again for a moment and put in the chat what type of project you're interested in doing. So I will give you a little bit of time to type. This is when I wish I had the Jeopardy music. Let me take a look at the chat. I'm not sure. self-management and support groups. Yes, and I see the question about IRB. Yes, if your institution uh, does have an IRB, which is an institutional review board, you can take your project to them first. We will also need to review it on our end. I see social determinants of health, a photo voice digital. Ooh, things are moving quick. Photo exhibit. Okay, working with the libraries, promoting diabetes and cardiovascular health, unhoused population. These are all great ideas. Okay, thank you for sharing with that, your ideas. If you are curious about what NNLM has funded in the past, please look at the NNLM Proposal Writing Toolkit. There is a link to a listing of past funded projects under the Project Planning tab. You can filter by organization type, such as public library or faith-based organization. You may want to align your project with one of our current initiatives, such as confronting health misinformation, bridging the digital divide, or the environmental determinants of health. The link to the past funded projects is not only on the toolkit, but it's also in today's handout as well. And please keep an eye on our regional webinars for successful funding ideas. In March 2023, Region 7 showcased projects that focused on cancer screening and prevention. And a link to that recording is in your handout. Other regions offer similar webinars on past funded projects, and those webinars are on our YouTube channel as well, so you can watch and learn what other people have done. Okay, so, oops, here we go. My notes. We've talked about the network of the National Library of Medicine, our mission, the types of awards we fund. Let's talk about how to get ready to write your proposal. Now, here's my big warning. The NNLM online application has no save feature. You cannot save it and return to it later. We recommend that you become familiar with the requirements of the proposal and draft each part in a Word doc or similar program. And then you can copy and paste it into the online form when you are finished. So you can keep your Word doc handy and you can submit what's in the online form. And remember, to even get to that online form, you need to be logged into your user account, and your organization will need that organizational membership account. So those things are linked when you submit your proposal. You will find the requirements of any proposal for funding in an RFP or RFA. I began this webinar by telling you about our acronyms, NIH, NLM, NNLM, RML. Now I will go through a few terms that you will come across when you are looking for funding. RFP is request for proposal, RFA is request for application, and CFA is call for application. And basically these terms mean the same thing. I would say that RFP is probably what you'll see most often. The National Institutes of Health prefers RFA, and what I've read is that RFA has a more narrow focus. CFA is what you'll see from the Robert Wood Johnson Foundation, which is an organization that funds very large health-related programs. Other terms include letter of intent or letter of inquiry. Not all funders require this, but this is the way for the funder to take the pulse of what applicants are planning on before they submit a full proposal. They will want to know who you are, what population you serve, what your general idea is, and a time frame. Not all funders require this, and this is another area where all the regions are different. Some regions ask for it, some don't. If if the funder does ask for it, you should provide one. And then the letter of application is like a cover letter for a resume when you're job hunting. The first item in the proposal is evidence of need. And evidence of need is your community's need for health-related projects rather than your need for money. We will get to that later. Funders want to make sure that you are serving the needs of your community. To prepare this part of the proposal, brainstorm about what you are seeing from your vantage point in your organization. And then you will want to look at publicly available data, and I will go through those options in a minute. Then next, you want to get up from your own desk and talk to other people to learn what they are seeing from their desks or their vantage points. Start with a list of community organizations that are involved in health information outreach. Faith-based organizations, anti-poverty organizations, libraries, YMCAs, educators, food banks. What do they see? Lastly, consider talking to non-users of your organization. It might be interesting to hear from people who do not go to the library or people who do not attend the health-related programs that are offered at the Council on Aging. Find out their perspective. What are the barriers for them? Nothing about us without us. So let me know in the chat if you have heard of this phrase. And I'll take a peek at the chat.
Margot, there was a question.
Sure.
That I can read to you. So I think this was from Sarah. Does NNLM ever fund small construction or electrical projects in libraries? For example, to add additional power outlets to an existing library space?
I have heard of NNLM paying for wireless drops to expand the access to the internet. So if it has to be connected to health information outreach or the digital divide, which the wireless drops would and the best thing with any specific question about your circumstance is to talk to your regional medical library, but having a connection with internet connection would help. But I'm not sure about construction itself. Maybe for ADA compliance, you might think about it in terms of that.
And Marco, I'll just add that I know NNLM has funded some telehealth projects where they
Yes.
converted like a storage closet to
Yes.
a telehealth space, which may have needed, small construction and electrical work. So
Yes. Okay, I was seeing a bunch of no's in the chat about this nothing about us without us. So this phrase originated with disability activists. And it means that the plans to address the needs of people with disabilities should include input from people with disabilities. And I'm hearing this phrase with regards to all sorts of communities. So as you work on your proposal, please consult representatives from the community that you hope to serve. Rebecca, was added in the chat for now?
yes.
Okay.
Oh, wait,
Thanks.
something just came in.
Okay.
I don't know if this is typed correct. A CEA? You said CFA a moment ago, I think.
CFA, yeah,
I don't
call
know.
for application. I've even heard CFP, which is
Oh,
call for proposal.
somebody said, Liz chimed in, Collection Equity Award.
Ah, that is a type of award that we have, that some of the regions have offered to help update your library collections. So that is another type of award that may be available in your area. Thanks for the questions, everyone. On this slide are some publicly available resources to help you demonstrate evidence of need. And the links are also on today's handout, these exact links. You can gather statistics from the CDC, the NIH, and the U.S. Census Bureau. State and county health statistics are available from the Kaiser Family Foundation and the Robert Wood Johnson Foundation. And there are resources specific to rural and urban health as well. Community health needs assessments are available from nonprofit hospitals. By law, these hospitals need to do an assessment every 3 years. They are required to share their findings on their websites. But sometimes these assessments are buried in the hospital website. They might not be the thing they need to put front and center. So I recommend Googling the name of the hospital or the county name and then putting community health needs assessment in quotes. And usually that will get you there. The hospitals have done a lot of the groundwork with identifying relevant health data and by asking community organizations and community members about what they perceive as their most pressing health needs. It's really worthwhile to take a look. These reports can point you in the direction of statistics that you might want to include in your proposal. So it's just a helpful jump start.
Margot,
Yeah.
there's a question here that I think might pertain to at least this area from Christine. In the RFP, and I guess it's the response, should we then include citations to back up statements of need?
Yes. And I will later in the webinar, I'm going to go over a sample proposal that we funded several years ago. And yes, that is very helpful to make a statement and then have some data to back you up. Good question. So for the community health needs assessments, I want to be clear that for-profit hospitals do not need to do this. Sometimes they do have a health assessment of the community, but they are not required to. The requirement is tied to the nonprofit status. It's actually a requirement of the IRS. If your nearest hospital is for-profit, just cast your net wider to the nearest nonprofit hospital if there is one in your community, or you can search for a county assessment. A lot of counties do health assessments as well. Okay, so after we're looking at the evidence of need, next the funder wants to read about your goals and objectives. And my favorite way to identify my own goals and objectives is through using a logic model. So on this slide is a bare bones logic model in a table. For more information about logic models, please check the link to our National Evaluation Center resources, which is on today's handout. So on this slide is a table with 6 columns, and we will work backwards in the table. So for our goal, we want to think big. For example, our goal is to improve health. The last column in this table is labeled long-term, and below it says improve health. Now, this is an especially large sweeping goal. You might want to work on something a little more specific, but not too specific. Next, we will work on our outcomes-based objectives, and this gives our project more specificity. So we move backwards to the next column labeled intermediate, and that column lists Search Medline Plus as a sample action to get us to improved health. So maybe you are planning on inviting community members or your staff to participate in training on accessing reputable health information from the National Library of Medicine. Or maybe the next item in that same column, you will be purchasing technology such as hotspots to loan, or, as we were mentioning earlier, what you would need for a telehealth appointment. Or maybe you will be launching data services for biomedical research, and your intermediate objectives are for your target population to utilize the library hotspots, or in our on-the-fly example, the telehealth the converted closet, or consult the librarian for data management. Let's move backwards to the next column labeled short term. So particularly in a short-term, 6-month to year-long project, you want to focus on short-term outcomes rather than the broader impact of improving health. Who knows if you'll be able to improve the health of your community within a year or 6 months. That would be a bit miraculous, but you could achieve some short-term outcomes. Your community members or your staff will learn how to identify, apply, produce. Think through what you are trying to achieve in terms of increased knowledge or skills. If we go backwards again to the column labeled outputs, this is where you identify your measurable outputs. How many attendees did you reach from your target population? How many staff did you train? How many hotspots did you circulate? How many data projects did you support? Under the column labeled activities, include process activities such as coordinate with staff and or your community partners. Develop project, conduct project, evaluate project. This is all about your process. Finally, in the first column labeled inputs, we have what we're starting with. Your staff, your internal and external partners, your time, money. So we have our inputs and our activities for getting this project up and running, our measurables or outputs, the short-term knowledge and skills-based outcomes, the intermediate action outcomes, and the long-term impact or your goal, improving the health of our nation. In some logic models, we will account for our assumptions. For example, we are assuming that our community partners or our IT personnel will support our efforts. And we account for external factors such as the weather or maybe rates of infection during times of seasonal illness, how that might impact your project. You're thinking ahead. I encourage you not to go crazy with goals and objectives. If you have one sweeping goal and 2 to 3 objectives, that's great. And we will talk more about measurables and goals and objectives at the end of the webinar when I share those excerpts from a successful proposal. You will need to demonstrate your process through a project timeline. For example, your proposal states that you will hold a kickoff meeting with your staff in May and develop the project over the summer, hold trainings from September to February, and then evaluate everything in March. You are letting us know that in March you will sit down and figure out to what extent you were able to implement the project as planned, how much community interest you generated, and if there were any situational factors, such as IT problems or the weather, that impacted your outcomes, and how you adjusted for that. At the end of the project, you will submit a final report to NNLM. Additional documents include a resume for each person that is working directly on your project. And this will show the funder that the people involved have the skills to implement the project. If you are working with community partners, which we encourage you to do, identify them and get letters of support. You could say that you're going to work with the YMCA, but if the funder doesn't see a letter of support, they might wonder if the YMCA even knows that you are planning to work with them. You want to include a detailed budget. You will want to identify what you need and how much you need. I will talk more about that in a minute. You will want a narrative or justification of the budget, as well as a table of the budget. You will need to include an evaluation plan and a continuation plan. And what I mean by continuation plan is most funders are expecting that they are giving you seed money to try out an idea. They do not anticipate that they will be able to fund you year after year. They want to see that you are thinking about how you will diversify your funding streams to continue this work after the grant is over. Or you're planning to take the results of your work to your organization to make a bid to have it covered in your organization's budget in the next year. For evaluation planning, I highly recommend that you check out this website from our National Evaluation Center. We don't have time to go into these resources today, but this webpage will go over community assessment, logic models, measurable objectives, and how to develop an evaluation plan in greater detail than I can do today and within the hour. There are some great ideas for working with specific populations, such as K through 12 students, people in the LGBTQIA plus community or in diverse communities, and folks living in rural America. I will give you a tip about evaluating the impact of your project. Identify the use of the health information resources that you shared with the community, or the use of items purchased with your funds, or the use of services that you developed and offered. It doesn't need to be too complicated, and we will talk about this more when I share the sample project. Rebecca, anything I need to know from the chat before I move on to the budget?
Um, well, the question is kind of about the budget. I'll read it to you, and so you'll figure out when to answer it. It's from Christine. She said, "What if we can't find or hire the resource?" And in her case, it would be hiring a student worker until she's actually funded. So when she submits the budget, she wouldn't know who that person is. Is that
Right.
okay?
Yes, you can tell us what your intent is and what the background, I would I would advise you to say what you are looking for and to say that it would be a student. And again, touch base with your regional medical library. One thing, and I think I have this in bold in my notes right here, it will not ding you to ask questions when you are preparing your proposal. We want you to be successful. We would much rather take some phone calls and emails ahead of time and have some good, strong proposals to review instead of, having proposals that include items that we cannot fund. So it won't ding you to reach out with questions. I really encourage you to reach out to your region with questions. Okay, so let's talk about the budget. So the first thing is to look at the RFP or the RFA, whatever it's called, and find out what is allowed and what is not allowed. And we've talked a little bit about that. NNLM does not allow funds to be used for food, furniture, or swag, such as t-shirts or water bottles with your logo on them. Now, we know that food is a big draw for community programs, so please plan on other funds covering that. And other funders that you work with might have different restrictions. Make sure you mention the need for your items in your narrative. And again, contact us with any questions. We're happy to answer questions. And then when you're writing your budget, you want to be thorough. You want to create a table with line items. This is what we need. This is how much it costs. For personnel, which we've just mentioned a little bit, we will want to know the number of hours that are the number of hours, I'm sorry, dedicated to the project and the cost per hour for each person. And this is where you really should talk to the people who handle grants at your organization. Do not assume that you can submit a grant on your own. I'm speaking from personal experience. To get a clear picture of personnel costs, specifically when you're talking about your internal people, you need to think more than the person's salary per hour. Personnel have benefits, which should be included in that figure. And then basically what we need for consultant costs is the same thing. We want to know the number of hours and the charge per hour. You will want to identify any equipment that you hope to purchase with the funds, laptops, tablets, headsets, and any supplies you will need. So account for photocopies, that sort of thing. You will want to calculate your travel costs if you need to travel during your project, number of miles and cost per mile. We use the federal cost per mile, and so that's pretty much a standard. And then there are indirect costs, which confused me when I was first writing for grants. These are sometimes called facilities and administration costs, and this acknowledges that your organization by rights can take a percentage of the grant for processing the money for you and for covering the costs associated with using your facility, such as the cost of electricity. So remember, NNLM does not fund individual people. We fund organizations. So the check goes into your organization's system. If you're working in a small organization, some funders will only work with organizations that have a 501c3 nonprofit status. Small organizations will often partner with a larger nonprofit to handle their money, and that larger nonprofit will receive the indirect costs for processing the money. I wanted to give you a heads up about that, because that was something I did not understand when I was first writing for grants. You want to be careful with your numbers. Make sure they add up and make sure that your numbers are equal to or less than what the funder is offering. If the funder is offering $5,000 or $10,000, do not ask for more than that. Every year we get requests that are going a little bit over that, and automatically we have to put them in the maybe pile because we're not sure they can run their project with less money. If we really like their idea, we give the proposal back to them and we tell them to redo their budget. So it's a time waster. So here are the 5 common mistakes, and then I'll take another pause. Let me go through this. The first is waiting until the last minute to gather your information. So based on everything that we talked about today, a good proposal does not happen quickly. I know it's tempting when you get an email in your inbox or someone tells you that there's an opportunity, but maybe there's only 2 weeks until it's due, to really want to throw something together. My advice is to either clear your desk of all other responsibilities so you can put your full energy into it, or if it's an opportunity that comes up every year, to consider learning about the requirements and waiting until next year to submit, because it does take some time. The second common mistake that people make is proposing an idea that does not match with the purpose of the award. And some of this is really due to your organization's just basic need for funding and the hope that this source will work. But if you read through what the funders are looking for, you might find that your project does not match. Please read the requirements carefully before putting a lot of work into a proposal. The third mistake is similar, and this is ignoring the instructions when writing the proposal. Reviewers are looking at a lot of proposals, so following the instructions goes a long way in helping the reviewers to do their job. Fourth is creating a budget that does not match with the narrative. You want to create line items for what you need for your project, and you want to make sure that those line items are talked about in the narrative of your proposal, so they don't seem to come from out of nowhere. The last common mistake is assuming that reviewers are experts in your community and in your field of expertise. Many times, funders will have outside partners to help them review funding proposals. Here at NNLM, we ask previously funded partners, librarians, and others working in health-related fields to help us decide if projects have merit and deserve funding. We might already know you, but other funders might not. So we recommend that you give basic information about your community, the health needs of your community, and how your community will benefit from your project. Okay, before I go over this criteria, is there anything in the chat I should know about?
Yeah, there were a couple of things, and I'm not really clear on, well, there's a question from Janice, and when you were talking about, well, including benefits, paying
Uh-huh.
people, personnel budget isn't just straight hourly wage. And she put benefits for consultants with LLC, which limited liability corporation,
Hmm.
hiring as a vendor, question mark. So I don't, um,
Yeah, I think you could just take what we're interested in is that final figure, what they're charging per hour. You don't need to break it down for us. It's just I think sometimes when we're thinking about our staff time, we only think about what they make per hour, and really what they're worth to the organization is more than that.
and then there's oh, maybe it's from Janice as well. She asks, should we advise you we are submitting multiple grant applications for the same project? So,
To other places, we it might be handy if for us to know if you're submitting multiple to NNLM, but um, I guess if you think you're getting funding from other places, maybe that's what that is.
yeah, and I would think that, I don't know if that's considered double dipping,
Yeah,
but maybe you're applying for funding, certain type of funding from one organization and other type of funding from NNLM. So
right.
maybe so.
Yeah.
There's one other question here. Are there grants available for public libraries, or is it more based for those in the medical field?
Oh, absolutely for public libraries. We fund a lot of public libraries. Yeah. And we're happy to work with you. Especially, we have a lot of people here who are first time grant applicants, and we're happy to work with you.
And one last question here. Is it possible to account for a situation where your organization will pay for part of the project, but you need additional funding from a grant?
Yeah. And so you can absolutely do that. Yeah. We are a reimbursement model, which happens with many organizations. So you do need to pay for things and then submit for reimbursements, and that can hang people up. Um, but sometimes for a public library, for example, your friends can pay for something and then get reimbursed after. All right, let me get through the criteria for how we judge. I encourage you to check the toolkit for more details about how NNLM rates your proposal. But here are the key elements. Does the proposed project make a significant contribution to the mission of NNLM? The mission was what I spoke about earlier. Does the proposal explain the need for the project, including demographic information about the target population or the geographic area? Does the proposal show logic and feasibility of conducting outreach to the target group? Does the proposal include a timeline or implementation schedule for major events and activities? Does the project include National Library of Medicine resources such as PubMed, Medline Plus, clinicaltrials.gov? This is very important that you are linking to either our resources or addressing the initiatives that I mentioned before, addressing misinformation, the digital divide, and environmental determinants of health. Those are all things we are working on right now. Is there an evaluation plan? Does the plan make sense given the goals and objectives? Does the proposal clearly outline the qualifications, roles, and time commitment of the project staff? Is the proposed budget within funding limits? Is the budget justification sound? Does the project promote diversity, equity, and inclusion? Please check our toolkit for a list of populations that we hope to serve in terms of diversity, equity, and inclusion. We have a long list of people that we hope to reach through your projects. That's why we want to partner with you. Reviewers are given the opportunity to comment on the strengths and weaknesses of the proposal. So if your proposal is not accepted, look at the comments and think about how you could rectify for the weaknesses for a future submission. Yeah, I think there might be some questions coming into the chat. I want to get it through another few slides so I don't run out of time, and then we'll get back to you. A few years ago, Region 7 funded a project called Dementia Friendly Nahant. So Nahant is a small town on the Massachusetts coast. And here is the introduction to the proposal. Dementia Friendly Nahant brings the national Dementia Friendly America model to a local level. Nahant has an aging population with an estimated 102 people experiencing some form of dementia and an estimated 168 people, often family members, caring for them. This means dementia impacts nearly 8% of Nahant's population. As the population continues to age, this percentage will continue to rise. The Dementia Friendly Nahant project enlists the services of the public library, the Council on Aging, the Nahant Village Church, and the Greater Lynn Senior Services to provide materials, services, and programs for people with dementia and their caregivers. We hope to create meaningful experiences and decrease feelings of isolation in the affected families while increasing understanding within the Nahant community. So the proposal was supported by 3 data resources. The first one was census data. Based on the United States Census, Nahant is a small community with an aging population as the baby boom generation is expected to live to be 80 years or older. An increased percentage of the population will experience dementia within the next 10 years. And as earlier somebody had mentioned, a citation was included. Data point number 2 from the local community health needs assessment. In the community health needs assessment by Spalding Rehab, dementia was mentioned as one of several mental health issues for the Massachusetts North Shore. And again, the citation was included. And then there was an internal observation. One patron periodically comes into the library, pleasantly asking the same questions of the library staff each visit, not remembering that he had asked before. So giving an anecdote such as this humanizes your story and your evidence of need. So it's fine to include this. You also want to include some hard data to make the argument about why your community needs funding. Okay, I want to address these 3 objectives, and here's where I want to get you into the chat, and we will take a look at your questions too. But let's get through these next 3. And so here I'm going to show you some objectives, and I want you to think about how you can measure these things. Some are easier than others. So the objective 1 was to circulate materials in a variety of formats. I remember in particular they had actually went old school and got CDs of music for that population, what they used to listen to when they were young, and also any other materials that would be easily understood by and inviting to patrons with cognitive difficulties in order to afford these patrons some positive interactions with literature and music to improve mental health and quality of life. So here I'm going to put out to you, how could you measure, and this is circulation statistics. So we have any librarians in the crowd? Yep, Circ stats. That's the easy one. Circulation stats of the health section. Okay, so this next one is a little trickier. Provide authoritative information on diagnosis, treatment, and coping strategies to people with cognitive loss, their caregivers, and the public using Medline Plus. So we do want to see that you are including resources from the National Library of Medicine, and it's a little tricky to measure hits on a national website such as Medline Plus. So if you have any ideas, you could throw them in the chat. One idea that I thought of is you could actually measure it by staff instead of your patrons. You could, I used to work in public libraries, and we do a little check mark. And I see a hand raised, but if you could put your comment in the chat, that would be easier for us. Thank you. Yeah, provide handouts. Yes, and have that count. Yeah, for displays or if you had an event. And then the third, host a monthly memory cafe for people with cognitive loss and their caregivers, and host a town-wide read for the community to foster meaningful socialization and education, reduce feelings of isolation, and improve social behavior and quality of life. Now, in some ways, I think this is two objectives, to host the memory cafes and measure those, and then to do a community-wide read, because how you measure those things might look different. So my point being is, when you come up with these objectives, think about how you're going to measure them, because that'll help us with that kind of like the nitty gritty. All right, last slide, and then we'll take a look at the chat. This proposal included 3 letters of support, and each letter was written on a letterhead, and then it was scanned and uploaded as a PDF along with as a support document to the application. The content was very simple, and the purpose was very simple. These partners offered to provide refreshments, give guidance to the library staff, and to announce events through their own channels. So we have the Council on Aging, the Village Church, and the senior services in the area. Based on these letters of support, NNLM knew that these organizations were true partners of the applicant. Okay, so that's what I have. I'm going to take a look, take a look at the chat. Also, at any time, Rebecca can put the link to the CE.
Okay, I will do that now.
Yeah.
There were a few, if I back, I have them, the
Okay.
questions. So hold on. So there was one, if we make a purchase before funding starts, assuming they were, funded,
Right.
can it then be reimbursed?
We're kind of sticklers for that. It has to be purchased after you've received, your notice of award. So no, unfortunately, you can't go backwards.
And then dates of award, and I think those are just it's a different per region, right?
It is. We are working in Region 7 to get something pushed out this fall, but we don't have dates yet. You really need to go to your region and filter, on that website and filter for your region to find out when.
And also, are letters of support a requirement?
No, they're not a requirement, but they always make us smile when we see them. And either if you're working with another organization, or sometimes it'll be your director or someone above you that says, "I know my person here, my employee is working on this, and I fully support what they're doing." That really, it does add to your application. It's not required, but it certainly adds to it.
And then the last one here, I think this is also from Christine, which may be, well, what section of the application should the personnel CV/background be added, or just send it as an attachment? And
I would send it as an attachment. Sometimes what people do is they take all their, sometimes they'll do them individually, but sometimes they'll take everything, the letters of support and the resumes, and scan them all into one PDF, whichever works.
And Liz suggested, Liz Mars, who works for NNLM,
Ah, yes. Hi, Liz.
That people might want to subscribe to their region's newsletter.
Yes.
And that's where funding awards would be announced.
Yes, this is why it's great to have colleagues in the webinar, because that's exactly what we suggest to people. Subscribe to our newsletter, and we'll let you know when funding is announced.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel, or select a video thumbnail to watch another video from the channel.